Hi, my name is LaurenMikol. I'm a school psychologist at a school in Madison. A big part of my job is supporting children in their learning and trying to find whatever obstacles there are for their learning. And what we're finding in the schools every single day is that lack of adequate health care because of no insurance or inadequate insurance is really affecting a lot of children. I'm going to give you some examples from just my school, which has 375 children. Every day we have children who are struggling with severe mental illness issues, and we're having trouble finding any people to provide services for them in the community. In addition, we have kids who will struggle for months and months with dental problems that are causing chronic pain, so they're trying to learn with their chronic pain. We have children who have got asthma, but they don't have routine care for that asthma, so there's no management of disease, and so they live from crisis to crisis. They often stay home from school instead of coming to school, because they don't have the medical care to make sure that they're just going to be able to function with that asthma. They go to the emergency room when they need to, otherwise that's the only medical care they get. We have children who don't take their daily prescribed medication because their families can't pay for the medication. We have children that are actually citizens because they were born here, but their parents are illegal, and so those parents won't sign them up for something like Badger Care because they're afraid of being found out, and so those kids don't get the care to which they're entitled. We used to have some health care clinics at our school where twice a year there was free checkups and shots and dental checks and check of their vision and things like that. And we used to have so many families that would come to those that they would wait for hours and hours and hours in line to get those medical services, and then some people would still be turned away because the clinic hadn't reached their capacity. Now the providers of those clinics have decided to not offer those clinics anymore, and instead they're trying to focus on signing children up for Badger Care. But there are many children who don't qualify for that for various reasons, and so those kids now get nothing. For those kids, the only routine care they get is going to the school nurse. Then we have children who themselves are healthy, but they have parents at home that are very ill, possibly even with life-threatening illnesses of one kind or another. And those kids, I had one this year in particular, who came to school every day worried that when he went home that night, he would find his mother either in a health crisis or even dead. It made it really hard for him to focus on learning at all. So that's another issue in terms of just the parents not having the adequate care either, and so their health problems affect the children. And then we have an example of a child whose family was involved in a car accident. Their car was broadsided by somebody running a red light, and he was the one on the side of the car that got hit. He was so severely injured that he spent 3 weeks in the hospital and another 6 weeks at home before he could return to school. There was some insurance coverage that covered part of that, but when it came to his coming home, there wasn't coverage for any kind of home care. And as a result, his parents had to quit their jobs, and after they quit their jobs, of course, they lost income. And then as a result of lost income, they lost their housing. So this is another example of not having adequate health coverage is really going to affect, the whole family and even precipitate homelessness. So those are some examples just from my school. And if I multiply that by all the schools across the country, we've got enormous amount of interference with children's learning, and there's just no chance for us to do anything about the achievement gap in those circumstances. So that's why I'm in favor of some kind of a single-payer public option, making sure that everybody gets adequate care, quality care, it's available for everybody, and at a cost that people